Okay. Acha, there is some person with an identity RAN 268. Please identify yourself, otherwise उनको हम निकाल देंगे because मुझे पता ही नहीं है वो कौन है. So we'll give another 5 minutes for that person to at least tell their name कि ये कौन है. Otherwise हम उनको निकाल देंगे. And we begin with today's lecture. Welcome everybody. Will not waste too much time in the intro. आज सर लेने वाले हैं इम्पोर्टेंस ऑन डॉक्टर रिलेशनशिप के ऊपर लेक्चर लेने वाले हैं एंड ही वुड बी स्पीकिंग ऑन हाउ इट शुड बी क्रिएटेड, व्हाट इज द रोल ऑफ द रैपो बिल्डिंग, हाउ टू डिसाइड वेदर टू टेक दिस केस और नो. वैसे सो विदाउट वेस्टिंग मोर टाइम आई जस्ट आस्क गाला सर to please start with the lecture. Sir. Gala sir છે કે નથી? હા.
Hello.
Yes sir, સંભળાય છે.
Audible?
Yes sir, audible.
Okay. Welcome you all on this new platform. I wish you all the best to have the right thinking on this platform. So this is applied Ayurveda in a different form on different topics. Today's lecture, as it has been decided, is doctor-patient relationship. Nima, everything's okay?
Yes sir, audible, completely audible.
Yes. So this is doctor-patient relationship. It's not a new subject. It is already mentioned in the textbooks of Charaka and Susruta. But this is something special which we have almost forgotten. What should be the doctor-patient relationship? So let us begin with the talk. As we all know, what is the importance of doctor-patient relationship? This is the foundation of our medical career in Ayurveda, and that depends on how you can develop a good relationship with the patient. Not only patient, when you are treating one person, you are treating the whole family. When you are treating the whole family, you are treating the whole society in short. So it is very important to have bondage with each and every single patient visiting you. The importance is when you treat one patient and when patient gets all right, he will spread his word. It will be through word of mouth to his family member, his or her family member, or maybe the relative. And you get the mouth-to-mouth publicity only by treating patient in a right way and having bondage with the patient.
Mute yourself. Please mute yourself.
So this foundation we have to create, which is we are not taught in the college, rather not even in any of the institutions. But this is the first topic we have chosen, and how to bring about, how to create this doctor-patient relationship. First of all, when patient visits you, when he has heard from somebody else and he visits you, he would enter the clinic, he would see the environment, the cleanliness of in the clinic, and how is the atmosphere in the clinic, and doctor himself or herself, how he presents in front of the patient. It should be tidy, smiling face, no stress, and so welcome the patient as soon as he enters your clinic. Now most of us have either small clinic or a big clinic, either having general practice or having consulting type of practice. Whatever may be the situation, we should welcome the patient with a smile. And ask the patient to sit and he would first observe your clinic, your face, your attitude, and then he might start his narration. What is the role of support building? How to create rapport? Once you welcome the patient, listen to the patient carefully, give patient full chance to express himself or herself without any interruption. At the end, you still ask, have you got anything to talk more? Once patient is exhausted with his queries, with his complaints, then you start talking. When you take up the patient on the table, examining table, be gentle and have systematic examination right from top to the bottom, which would hardly take 1 minute. This topic is an entirely different one, which we may take later on of the examination of patient, clinical examination of the patient. Once we have talked about the different complaints of the patient, we have not yet seen the reports, and not to see the reports to begin with. First, you have your diagnosis from the patient's history and clinical examination. Make your own samprapti, make your own diagnosis if possible, and then you may correlate it with the patient's reports. So it would be unbiased um, decision on your side. When patient is observing everything, listening everything, patient may start with the reports, but you have to refuse the report to begin with. And once we finish this clinical examination of our samprapti and diagnosis, then and then only we have to confirm it with the patient's reports. If the reports are too many, go through only main reports. Or if you have any assistant, to ask the assistant to go through the main reports and make a short note of the reports. Or you may confirm it different points with the reports. Then patient is very inquisitive in knowing the disease, and patient has come to you only after trying so many other consultations with different doctors, different physicians, I mean different modalities of the medicine, and after not getting the desired result, patient has come to you for Ayurveda.
Sir, एक
So
minute,
you
एक
have,
minute. Sajala, please mute yourself. Dr. Sajala Joshi, please mute yourself. Sir, please continue.
okay. Sajala is there.
Yeah, she's there, sir.
Okay, we continue. Which patient to be taken and not to be taken? Certain conditions where we have to be very clear and define very clearly that this patient requires further line of treatment at higher centers. For example, when patient has got unstable angina, symptoms of unstable angina, refer the patient immediately to the hospital. When you suspect patient is having pneumothorax, once you confirm pneumothorax, then you better send the patient to the higher centers, because these patients will require immediate attention, immediate treatment. Otherwise, patient may die. So these are the patients. Like DVT, patient should not develop pulmonary embolism, which would be a life-threatening situation. So such patient also should be referred to the higher centers. If possible, try to connect with the consulting doctor in the higher centers if you can, and then direct the patient accordingly for time-saving procedures. After the procedure is over, uh, keep a track of the patient, what has happened, and how the patient was treated, and what was the condition later on. That is as far as the referral of the patient to the higher centers. Then patients who have already come from the higher centers, from different consultants, and now they have come to you, and then it's a very challenging situation, whether we can treat it or not. Long-standing acute conditions, chronic conditions, or acute on chronic conditions, you have to define and treat the patient accordingly. But for that, you have to take the patient into confidence and never threaten the patient that patient is having uh, a very dreadful disease. Even if it is there, you tell the patient or the relatives in a very fine way, very polite way, and make sure that patient is not frightened. Patient is already in agony. Patient has already got intolerance. Patient is already having insecurity. So try to reduce the insecurity of the patient and be calm and cool in deciding the line of treatment for the patient. And what patient expects from you, patient will definitely ask for that diagnosis, and he has already come prepared with the allopathic diagnosis. And then you have to confirm with the allopathic diagnosis and try to convert it into Ayurvedic diagnosis and reply the patient according to Ayurvedic text and Ayurvedic samprapti. Patient would feel confident when you explain the situation in a nicer way. Once patient has heard about from you, they would think over whether to start the treatment or not to start the treatment. In such a situation, I would ask the patient to uh, get more time, take few hours or few days to decide whomsoever he wants to confirm. Uh, let him confirm and then let him come if he wishes to come. So you are giving full freedom to the patient about liberty to select the doctor, to select the line of treatment. So that would be a lot of confidence. The patient would feel that you are not cheating or you are not side tracking the problem. Um, you have choice to select the patient. Patient has got choice to select the doctor. Patient is already selected after trying any other system of medicine to Ayurvedic treatment. So it becomes your responsibility to deal with it very carefully. Once you listen to the patients very carefully, you may note down few points, and patient would feel that doctor has heard his or her agony very calmly and coolly. Patient would develop more confidence. Uh, what effect or impart we should create with the patient when he's visiting the clinic for the first time. Once he has seen the atmosphere, he has seen our co-workers, he has seen the doctor, and how you impart your knowledge as far as clinical examination and explanation of the patient's problem. Patient would feel more confident. Then rather, patient would feel like pouring out his heart of any other problem which is psychic or somatic. Nobody has heard the patient so much in detail that you are listening to the patient. So that itself will give a lot of confidence in patient. That's a very important and primary part. We may feel that we don't have so much time when treating so many patients in the clinic. I would suggest that if we are giving the treatment for 4 days or 6 days, you might give for 10 days or 12 days or 15 days. So number of patients would become half. You can spend double time for each patient if possible. Ultimately, at the end of the day, at the end of the tunnel, we should feel satisfied that we have done the job correctly and we have directed the patient accordingly. This type of impact patient carries in his mind, he would start telling other family members or other relatives or their society, and patient would tell the other patients to visit your clinic, and this is what the impression patient would carry from your clinic. As far as the treatment part is concerned, diet part is concerned, I would prefer to give the diet for first 10 days, not for a long time, first 10 days. And in those 10 days also, we tell the patient, you follow the sense of hunger and then eat accordingly, maybe 10 to 15% lesser than your sense of hunger. And once you feel very hungry, then from initially a watery or liquidy diet to semi-solid diet. When you feel still more hungry, then solid diet, which may take about 10 to 20 days time. And by then, we can achieve a great relief in patient's condition. So many conditions like fibromyalgia or conditions like, DVT or maybe swellings over the legs, maybe breathlessness, maybe cardiac problem, hypertension, diabetes, neurological problems. You have initiated the treatment and patient feels confident that he would feel better with your treatment. Follow up after maybe 5 days, 10 days, 15 days, 20 days. Either you may get the certain tests repeated to see the efficacy of your treatment, and accordingly patient will feel comfortable with the results. As and when necessary, you have to tell the patient if there is any problem, any emergency, you are available on even phone call, and you have to direct accordingly. So patient feels homely when he is even out of your clinic. That's very good rapport you can build up. Then comes uh, how much to stress upon the treatment and how much to stress upon the diet. So we consider that diet and medicine go hand in hand. But at the same time, sometimes you have to tell the patient that keep your mind calm and cool, and that is possible by one more line of treatment, that is meditation of their choice. Morning and evening, minimum 15 minutes to half an hour. If the time permits, they should do meditation. That would add to your armamentarum. So we are doing holistic treatment to every patient. So many times, there is a number of problems. Different multiple systems are involved, and different line of treatment the patient is already on allopathic side. So you have to continue with the allopathic medicines if possible, and then review the situation periodically and modify the medicines or ask them to consult their own physician or surgeon for the remaining line of treatment in modern medicine. So patient is again feels confident that you know your limit of treatment, and patient would feel great. Nowadays, Google Maharaj, patients are already acquainted with, and they know their problem from Google, and they may ask you questions from Google point of view. Google might have told patient one line of treatment or multiple treatment, then you should try to modify them and explain them correctly what patient needs. It's a tailor-made treatment. It's not Google treatment. So again, here patient would feel better, and you have not ignored their problem, and you have given right answer, right reply to the patient. Counseling part is very important initially while taking the history of the patient, and while taking the history, you have to read in between the lines what patient is talking about, and symptoms may be different, and your findings may be different, your examination may be different, your approach may be different, and you will feel that patient doesn't require the treatment for what patient is asking for. For example, burning the chest need not be only hyperacidity. Could be cardiac problem, maybe high BP, maybe anxiety, maybe sleepless nights previously. So categorize accordingly and give the right treatment and right advice to the patient. If patient is not following your instructions 100%, you may give them warning that if you don't follow it properly, maybe you will not get the required treatment, the required results. Then you may ask the patient to stop the medicines and you approach wherever patient is comfortable with. So you are not neglecting anything. At the end of the day, you should feel very comfortable and satisfied, and you should get good sleep at night by yourself. When you uh, when you welcome the patient initially, you should have composed mind and how to bring about compose in ourselves, because patient may be so many in a day and you are only one treating so many patients. When you are composed, you will give tranquility to the patient and you treat the patient accordingly. So at the end of the day, you feel so nice, so great, and so satisfied. And these patients are bound to get more other patients to you next time. So this is the approach. And while treating the patient, when you do SLR, you come to know so many things only by SLR, like lower abdominal condition, lower back condition, then hips condition, knees condition, calves, so many things you can come to know. But you have to exercise extra care while examining the female patient. There should be
Hello.
a gentle approach to females and children. So, any questions? You are welcome. Yes, Ima.
Hima madam, you can ask the remaining questions.
Okay. Mm, Reclama questions to the point, sir. I was just listening to
We
you,
almost
sir.
cover कर ही दिया था. But suppose the patient comes with the idea that previous doctor or the previous doctors have suggested some treatment or their diagnosis, and if it differs, don't contradict the doctor, the previous doctor. Give them gentle reply that this is your opinion according to your knowledge and your expertise and your experience. So even if you have to differ, be straightforward and tell the patient that this is what I feel like. So don't get carried away by somebody else's diagnosis and treatment.
Sir, if a patient comes and asks a question, कि uh, they want to opt between allopathy and Ayurveda, or they want to do something else along with our treatment, then how should we answer them?
Since it is like, when we do postural correction, patient will ask, I'm giving you example, patient will ask, they are already doing some yogic treatment, then our answer should be, I've given you postural correction now, and you have already been doing yogic other correction. If you feel comfortable with that correction, you may opt for that line of treatment. Or if you feel comfortable with my correction, you can follow my instructions. So give the patient choice to decide whether the previous correction, previous treatment is beneficial or present treatment is beneficial. So patient would have chance to decide uh, line of treatment.
So that is about the postural corrections or things that we do in the clinic. Example, if we give Ashutan Nasya and they feel
Yeah.
comfortable, they are somehow convinced, somehow not convinced. It happens some of the times. But suppose
Yes.
if a patient comes and asks us that if so and so case is there, example, they are suffering from cancer and they ask us whether should we go for chemo, not go for chemo, or should we only opt for Ayurveda treatment. Then should we give a direct answer, not give a direct answer? What should we answer in such cases?
That depends on type of cancer and the stage of the cancer and patient's willingness to accept whatever you say. First of all, you get the patient investigated fully, and after the test reports are ready, line of treatment is ready, then you can give option to the patient. Generally, for example, I'll give the option. that you may visit, Valsad Ayurvedic hospital for cancer. For 11 days, they will admit and let them have treatment over there. They carry on all panchakarma treatment necessary for different kinds of cancers. Once that course is over, then patient would come back, and then you may accept the patient and you may continue line of treatment if it is available, and you can refer back to the same hospital, or you can refer back to the consulting physician or surgeon on modern side, and then reevaluate and then decide the line of treatment which is best for the patient, if patient accepts that.
Okay, sometimes the patient...
Half the way patient is already on chemotherapy or radiation therapy or already undergone surgery, then depending on the after effect of a different approach in modern medicine, if it is treatable by Ayurvedic medicines, you can always suggest.
Now, many of the times patients say that we trust you so much, so you take a decision for us. This is how they start talking. So what do we do in that case?
Yeah, then that's what I said. This is the option available. You can try that, and if you're comfortable with, you can continue. And after a continuation or in a prescribed period over there, then you can come back to me and then again review the condition. And if necessary, you can continue with the treatment. And along with modern people also, you can be jointly treat the patient in that particular condition.
Okay. Now, there are certain patients who are on antibiotics for, say, some kind of an infection or a fever or XYZ reasons. And if they want to continue Ayurveda treatment along with the antibiotics treatment, should we or should we not?
Good question. As far as patient is on allopathic medicines like anti-inflammatory, analgesics, antibiotic, then we should be very careful in accepting that and giving the treatment to the patient. I tell the patient in the first day of fever of any origin, they should visit for Ayurvedic treatment. Or if the patient is already on antibiotic, then probably you ask them to complete the course of antibiotic, and then remaining treatment you can continue with Ayurvedic medicines. Or third thing, don't combine like modern medicines in antibiotic, anti-inflammatory along with Ayurvedic medicines, or don't combine homeopathic medicines with Ayurvedic medicines. In certain conditions, if they are not very serious, then you can continue with the allopathic medicines along with Ayurvedic medicines, like long-standing diabetes or long-standing hypertension or cardiac problem, which are chronic. In those conditions, you can combine with allopathic medicines with Ayurvedic medicines. Even patients with thyroid, you can combine both the treatment. And once you have a certain good results, then you can compare with the next level of investigations and then review the conditions and treat accordingly.
Okay, so you are of an opinion that homeopathy medicine should not be combined with Ayurveda medicines?
No, it cannot be combined with Ayurveda because in both the conditions, the principal line of treatment is different. It may agonist or antagonist the condition.
Okay. Sir,
I don't know anything about homeopathy.
Okay. Some patients outrightly refuse to consume churans and kadhas, and they're okay taking tablets or syrups. So, how to deal with such patients?
Try explaining the patient that whatever kadhas or churans are effective may not be effective in the form of liquids or tablets alone, because they are gun. They are concentrated liquid in the form of tablets. Try convincing that if you have a cup of tea every day, and if you make a tablet out of the tea and dissolve it in the water and make liquid tea and then drink, the effect would be entirely different. But even then, patient is not ready. You may try in the form of mm, powders to be made into paste with water or whatever ingredients, and then so ask them to swallow it easier than swallowing the powder itself. Or if it is available in the form of gunner tablets or in the form of any other suitable media. As far as certain conditions, I ask them to stick to the treatment whatever you have offered for that particular kind of problem. And I think by persuasion, by convincing, patients are ready to consume whatever you give. Next point, I tell them it is not sharbat, it is medicine. So it is bound to be bitter, but it is better always.
Okay. So there are some patients who outrightly refuse to do diet. One is they don't want to do diet. Second kind of category of patients stand like they are traveling continuously, so they do not have options to eat. They have to eat from whatever is available. So how do we fit in our diet and medicines into this?
In that case, when patients are traveling or not ready to follow the rigid diet, and if the situation permits, you may give them relaxing diet or rather avoid least as far as possible, like curd, white flour, maida, cold drinks, ice creams, non-veg, certain things at least you avoid. If possible, try to replace with the ideal diet. If not possible, then at least avoid list you can give and patient is still comfortable with that avoid list.
Okay. Sir, Dr. Hina Bhatt has asked a question. Do the patients need to keep a gap of 2 hours between allopathy and Ayurvedic medicines? What do you recommend? Other
Depends on the condition of the patient.
Sir,
Either
एक
you
minute,
have to keep a
all the participants, please, Jitlapan Vaidyocha Bada, please start posting your questions so then we have enough time so that sir can answer our questions. Ha, sir.
yes. What is the point? Question?
Do we need to keep a gap of 2 hours between allopathy and Ayurvedic medicines?
I think gap of 15 to 30 minutes is enough.
Okay, fine. And if the patient is taking some, what do you say, cancer patients especially, they consume that Krishnavalli kadha, then they consume a lot of other, jungle from Madhya Pradesh. They get these medicines from Madhya Pradesh ka jungle, then that Shimoga medicines. So should we ask them to continue or discontinue those medicines?
If you feel comfortable that it is compatible, then you may ask them to continue both the medicines.
Okay, okay.
And if patient is already on those jungle ka kada or some herbs, and patient has not developed any side effect, then you may ask them to continue. Okay. But then periodically you have to keep checking about the condition of the patient and the reports, whether they are favorable or not.
Okay.
Otherwise you can refuse.
Okay. Dr.
Also to
Pallavi
talk
from...
about the fee structures to the patient. Hello.
Yes, sir. Yes, sir.
About fees.
Yes,
suppose
sir.
you charge 100 rupees to regular patients. For example, patient may say, it is too much for Ayurvedic medicines. If you feel that patient's condition is good, you can ask the patient, if you are not able to give my fees, I will reduce it. But you have to say you are not able to give the fees. The affluent patient will not tell this, will not declare that I am not able to pay. He is able to pay. But in those cases, you have to don't give them concession. But group of patients where they are still really poor, then instead of 100 rupees, you can ask for 50 rupees or you can ask for 25 rupees. But the point of concern here is don't tell them that usually I charge 100 rupees, but now for you I'm charging 50 rupees. Don't make the patient feel that you are obliging on them. You
Correct.
tell you are charging 50 rupees for that patient.
Okay. Uh, Sir, there are a few questions from Vaidyas. Vaidya Pallavi Kothalkar is asking, how should we convince patients not to do ati ambupan and not eat viruddha anna? मतलब फणगावेला वस्तुओं नहीं खावानी. How do we convince
If you
patients?
are sure about your diagnosis and line of treatment and your diet regime, stick to it at least for first 10 days, 20 days, 30 days, depending on the problem. Then you may relax. Once patient gets the result, you may relax the diet. It's not forever.
Dr. Aman is asking, it's a very interesting question because this question I face it every day. I think all of us must be facing this. Patient straight away ask, मुझे दवाई कितने दिन लेना पड़ेगा और मैं कितने दिन में ठीक होऊंगा? Because I have been to so many doctors, कोई मुझे ठीक नहीं कर पाया है. So how do we deal with this question?
Good question. First of all, whosoever is coming to me for observation, I tell them the Ayurvedic treatment, initiation of the treatment is just within 1 hour. No matter what kind of problem patient is facing, what kind of treatment patient has already taken, what kind of problem is patient is having, if you can give at least 10 to 25% of the result on day 1, it will be very easy for the patient to get the confidence, and you will be enlightened that this is a line of treatment. You can call the patient either once a week or twice a week or maybe alternate days or maybe daily, depending on the situation of the patient.
Okay.
When we give, that's a very fact that when we give nasya, appropriate nasya and asyotan to practically every patient is bound to feel much better than what otherwise patient has experienced so far from other doctors. Number 1. Number 2, what we are dealing with is only physical level, not at mental level. We know that majority of the problems are psychosomatic, where almost 90% of the problems are originated from the mind, and only 10% is actual at soma level. The treatment is reverse. Most of these soma problems are being treated almost by 90% of the medicines, and only 5 to 10% of the treatment is given to psyche. Here in Ayurveda, we have got a lot of opportunity. Treat the psyche first, no matter what patient is having the problem. For example, patient having recurrent diarrhea or dysmenorrhea, or patient is having hyperacidity or palpitation. We know it is coming from the psyche. So by selecting right uh, nasya on very first day, patient's psyche would calm down, patient would anxiety would come down, apprehension will come down, and the impact of calm and cool mind, the patient will feel the benefit at the body level immediately, and that we have seen practically in many patients. So we have got that chance to treat the psyche first and then the body. So very first hour of the patient feels much better with your treatment, and then you may start with the appropriate treatment at the physical level.
So it's more
This
like
is
how you.
This is the upper hand in Ayurveda, where patient would never expect that you can give such a great results in such a short spell of time, where patient is already defeated by other treatment, did not get any result, here in first hour of the treatment, patient is having comfortable, very comfortable. By the time patient leaves the clinic, he would be so happy and so grateful to you. He might join his hands to say thank you.
Correct, sir. But this is in patients who are receptive to put nasya and eye drops. There are certain patients who are extremely scared of putting the drops in the eyes or putting something in the nose. So how
So
do
in that
we?
condition, yes, in that situation, I usually first start with the very simple tripla pant nasya, astyotan, not nasya, tripla pant astyotan. Patients will be little afraid of putting drops in the eyes, but if you convince the patient and just allow, just a patient will allow you to put the eye drops, and immediately you will feel the cooling effect and soothing effect. Once he is
Hmm.
convinced about the Achyutan, then you can easily convince him about the Nasya. And then you can put the Nasya. Now, once he accepts the Nasya, he is bound to feel much better and more comfortable and more convincing level. This is what I deal with the patients. Every single patient I put the Nasya and Achyutan.
Okay. Sir, but there are certain patients. Example, today we had a patient who had done LASIK surgery, and
Sorry. I did not get in between.
there was a patient today in the clinic who refused to put the eye drops because she had done LASIK surgery, and I agreed, okay, fine, because the surgery was done just 15 days back. So
You
she
may
was
wait
also
for 2-3 weeks, and then you may start with the nasya and then put the eye drops.
okay.
If you give triple font in the as a Ashyotan, then it will heal the recently operated refractory index. So, and on the top I give a pack of triple font over the eyelids on both the sides. After putting the drops, patient will have very much soothing effect, and then you will be ready to accept whatever you say.
So should we put the eye drops first to every patient and then Nasya is what Dr.
No,
Dattatreya is asking.
no. If patient has already undergone lastic treatment or radial keratotomy or refractory index, then you may start with a nasya after 2 to 3 weeks. And once nasya is accepted well, patient feels comfortable, then you can put astyotan.
Okay.
Sir, in such cases, can we put some soothing nasyas like uh, anything like cow's ghee nasya or something like for the healing purpose or some healing nasya in initial phase also?
That all depends on the condition of the patient. Those patients who are really more of vata predominance, you can really give either uh, Gogrutanasya or Panchagavyanasya. Very soothing effect in case of Vata. But in case of Kaph Adhikya, you have to give Shodhanasya in the form of either Pradaman or Gursuntinasya.
Okay. Sir, there is a
And in Pitta
question.
Adhikya, you can give Shamanasya.
Shaman Nasya of what, sir?
Shamanasya, you can give milk with Gogrut,
Okay.
Shodhan milk,
Okay. Sir,
Sanskrit
I'm
milk.
shifting. Okay. I'm shifting the topic now. There is a question from
Yes.
Dr. Sheetal. She's asking, there are patients who do shift duties. So how to manage their food and sleep, as mostly whatever disease they have are due to lifestyle changes like
I did not
diabetes
get
and
the
high BP.
question properly. I did not get the question properly.
There are patients who do shift duties. So their sleep patterns and food pattern is very different as compared to people who do just day jobs. So how do we manage these patients? Shift duty patients. How do we manage their food
Shift
and sleep?
duty. Shift duty.
Huh.
Very good question. See, shift duty people have already they already have problem. They cannot adjust. Sometimes there may be weekly shifts duty or monthly shift duty, or maybe every day shift duties, and they are the worst people to, they suffer a lot. So what you can do is give them first tripla part Ashwatan and either Panchagavya or Goguruknasya. And immediately patient would feel as if he has slept uh, 8 hours good sleep at night. That feeling patient will have.
So they need to continue putting Ashwatan and Nasya every day, irrespective whether they are ill or not.
Absolutely no problem. Otherwise also it acts as a rasayan also.
Okay.
And to prevent, to postpone or to reduce the ongoing aging process, particularly neurological conditions in middle-aged or old-aged people, it will act as a rasayan also. It will nurture the brain cells. It will nurture the different organs of the body and different systems of the body. As far as osteoarthritis is concerned, hypertension, diabetes, or retinal problem, and different organ pathology is concerned, they will be really benefited. And you can really postpone the aging process. So it is better to put Nasya and Asyatan every day.
Correct. That is for patients. But sir, what do you suggest for Vaidyas like us? What?
Even we have to put this. We have to carry on the same treatment.
For ourselves. Okay.
Many times when we get tired, in a whole day's work, then we put good Sunti Nasya, and immediately you feel completely at rest. Or if you feel, you can put Asyatan also, Ripala, or maybe Elanir's Kuzumbu. So immediately you feel relaxed.
Okay. Okay. So right now in the chat box there is one more question that we go about, and then we have another 10-12 minutes for more questions. So the question is from Vaidya Neha. She's asking, sometimes some patients ask how much experience I have to solve the cases. How to go about such doubts? How to answer them?
Can you repeat what is the question?
Sometimes patient ask how much experience you have to solve such cases. So how to go about
That
such
depends on
doubts?
the condition of the patient and your experience and your confidence. It's immaterial how many years practice you're having or how much confidence you are. But if
No,
you are
sir. It's about
confident, you can really.
patient. The patient is asking this question.
If
That doctor,
patient is
have you
asking, then
solved
you
such
can
cases?
tell the patient that you have solved so many cases in this much period of time, and if not, then you may say, "Okay, I'll definitely try my level best. I'll apply my knowledge at the best, and you might get the result positive."
Okay, fine. Sir, there are no more questions in the chat box. So I would like the Vaidyas over here to please unmute themselves and ask if they have a question directly to sir. We have another 10 minutes to go. Any question related to doctor-patient relationship, or how to manage a patient, or how or
Yes, Hema.
how do you conduct yourself?
Hello, good evening, sir. Dr. Pallavi.
Good evening. Good
Yes,
evening,
sir.
Pallavi.
गुड इवनिंग सर. तो समटाइम्स ऐसे होता है ना, पेशेंट को जब हम लोग कभी किसी को भर्ती करने के लिए पूछते हैं, कोई दूसरे पेशेंट संधिवात का पेशेंट है या कुछ दूसरे कंडीशन का पेशेंट है, तो दे सेड कि इसका बस्ती के साथ क्या रोल है. तो वैसे नस्य या जब आश्वासन हम लोग डालते हैं तो दे सेड कि मुझे प्रॉब्लम यहाँ पे है, तो आप यह नस्य क्यों करते हो. तो हाउ टू एक्सप्लेन, उसको पूरी थेरी हमारी किस तरीके से हम लोग एक्सप्लेन कर सकते हैं, कन्विंस
I
कैसे
tell
कर
the
सकते
patient that Nasya has got direct connection with the brain. Ashwatan is
Okay.
also connected with the brain, and brain governs the whole body's functions by
Okay.
spinothalamic tract and different organs. The nerves are going, nerve endings are there. So even with a patient of um, myopathy or similar neurological problems, this Nasya and Asyatan has a big role to perform. And if they are relaxed, so many conditions gets corrected. So you have to explain the patient properly, few of them. And this is instant result oriented treatment as compared to other parts of Panchakarma.
Yes, sir. Thank you, sir. Thank you so much.
You're welcome.
Sir, Dr. Sajjala Joshi has asked how to counsel patients to take liquid diet for 10 days.
No, you may say it's not for 10 days. You categorize, you divide the diet in three major conditions. If you don't have hunger, have liquid diet so long as you are feeling hungry, little more hungry. So liquid diet may be for a day or two or three, depending. For example, I'll give an 80-year-old lady came with severe degree of amvat. Then with low grade fever, I asked the family member that she has to undergo 3 days langan only on water. He did not. He was not convinced. Then I had to modify my sentence. I said, so long as auntie is not asking for any food, you please don't give. Then he said, okay. If he is asking, then I'll give. I said, okay. In that situation, auntie could not feel hungry for next 2.5 days, almost 3 days, and then she was so much normal that she thanked me so often from native place. So this is the role of diet. We have to convince the patient accordingly.
Sir, there is another question from Satyavati regarding the diet. If someone has a past of anorexia, they are very scared of doing langan. They are very scared of feeling hungry. So how do we help such patients?
So in that case, if patient is not feeling hungry at all or anorexia, and patient is has vomiting condition, then in that case we don't give the medicine, we don't give the diet. First we correct the udavart, which is responsible for such situation, by putting lap on the abdomen. Once the vat, once we get the annuloman effect, then automatically nausea, vomiting, anorexia will come down, patient will start feeling hungry. This happens so often in hospital setup. Despite of so many medicines, patients are not feeling hungry at all. So in that condition, two things are very important. One is annuloman, and other is any lap over the abdominal wall. And third would be to give fresh ginger juice to drink, or maybe chew the piece of ginger and swallow the juice. These are the way, you have to deal with the patient every hour or every 8 hours or 12 hours or 24 hours. Within 2 days or 3 days, patient's condition would revert
Okay.
easily. And then you can give diet and medicines accordingly.
Okay. There is another question regarding langan. How to convince parents coming in with kids whom we prescribe langan?
It's not clear. Your voice is not clear.
How do we convince parents who get their kids and they are prescribed langan? How do we convince those parents?
Hima, still not clear. I'm not getting the question correctly.
How to convince parents coming in with kids whom we prescribe langan? એટલે કોઈ પેરેન્ટ આવે બચ્ચાઓને લઈને અને આપણે બચ્ચાને લંગન પ્રિસ્ક્રાઇબ કરે તો આપના મા બાપને કેવી રીતે કન્વિન્સ કરવા?
Depending on the condition of the patient and age of the patient, you may give lagu bhojan instead of langan. Lagu bhojan is also a part of langan. So children particularly and aged patients, you may give lagu bhojan, and that too, at daily basis or maybe every weekly basis. As and when patient feels hungry, you can give little more food to eat, give a little more liberty. and patients are usually convinced and they are ready to follow your diet. You should be very tactful and confident about prescribing the diet in particular problem.
Okay. There is another question regarding Langhan. When do we stop or relax the Langhan?
Very simple. When do you relax or when do you stop the Langhan? As soon as patient feels hungry, that's the time body wants to eat something. There is a sensation from within. And then slowly from Langan, pure Langan, you switch over to Lagu Bhojan. Then you switch over to semi-solid food. Then you switch over to solid food in gradation. And it will be very easy and convincing to the patient.
Okay, fine.
And there is no demarcating line as it is mentioned, in a Vata Jwar, 7 days fasting, or Pitta Jwar, 10 days fasting, or Kapha Jwar, 12 days fasting. It's not exactly those number of days. But as soon as patient feels hungry, and that's the time to either terminate the fasting or start Lagu Bhojan.
Okay. There is a question regarding Timir. Means if we select a wrong Ashchotan, can it cause Timir in the eyes?
There are certain conditions where if IOP is more, or if there is retinal problem, or AC or PC, there is problem floaters. You have to select the Ashchotan drug accordingly, and usually there is no problem. More with the glaucomatic conditions, whether it is narrow angle or wide angle glaucoma, you should know the samprapti of that particular condition in the eyes, and you select the drug accordingly for Ashchotan Vidhi.
Sir, I think we will
Usually
mark
there is no
this
problem.
question. Yeah, we will mark this question's answer for further in lecture also, because we would like to know more about how to decide what Ashchotan and what Nasi to put in such wide angle and closed angle. So you later elaborate in a separate lecture when we are talking about Ashchotan and Nasi.
Okay.
Okay. So right
But
now
first of
we're
all, you
left
should
with
know the samprapti. You should know the samprapti and then select the drug accordingly.
Sir,
Nowadays,
samprapti
as
nahi
far as
pata hai na, how
Ashchotan,
to decide.
one point I will make very clear. When you get the patient of dry eyes, which is very, very common condition, and more so in the developed country, dry eyes and dryness of the skin and dryness of the system is very, very common, particularly in the middle-aged and older age people. In that condition, it is increased vata prakop in the eyes and give Grutanasya and Gruta Ashchotan, like Gogrut drops in the eyes.
Okay.
This is
Sir,
very easy to treat.
which lap you were telling on the abdominal wall?
If it is Pittaj problem, you give either Avla or um, another lap which is very useful, or Hingu lap.
Okay. Sir, there is a question by Dr. Satyavati. It is not posted on the chat, but she's messaged it. The chat is not allowing it. A lot of people use alternative modalities like osteopathy, chiropractic therapies, craniosacral reflexology, acupuncture, kinesiology, oxygen therapy, chelation, etc. Lot of things. Are these okay along with our treatment?
See, you should know what other line of treatment patient wants to undergo through, or patient is already on, and you should assess what relief patient has got so far about his condition. And if you feel confident, suppose certain chiropractic treatment, they give only external treatment, or maybe acupressure, acupuncture, again it is external. If you feel you are comfortable, then put Nasya and Ashchotan and you will see the result immediately, whether what is works, and then you can carry on with postural correction if possible.
Okay. Okay. Fine.
Otherwise,
Sir,
you
there
should
are
know
two more.
what different line of the treatment other than mystic treatment patient is undergoing through. Then you should know and try to answer or whatever is comfortable with the patient.
Okay. Fine. Sir, we are taking two last questions and then we wind up the session. And then then it's a request to all the Vaidyas that if they have more questions, you can either post it on the group and then we take it in the next session uh, forward. And then we'll declare the topic which we'll take for the next session. That also we'll be declaring. Okay. Good Shunti Nasya. Can you do it continuously every day till there is evidence of samata?
So long as samata is there, whether it is sama kapha or sama kapha and vata, or sama pitta or sama kapha and pitta, or sama tridoshaj avastha, you have to put sodhan nasya till it gets resolved. Niram avastha is achieved. Till then you have to put this nasya, sodhan nasya. It is very surprising to know even maculopustular pimples, particularly maculopustular pimples. We know it is pitta adikya, but it is sama pitta adikya samprapti is there. So we may give shaman nasya, but here we are making mistake that this is sama avastha. So you give first sodhan nasya, then you can switch over to shaman nasya. Sodhan nasya itself, 1 or 2 days, all the pustules, maculopustular conditions will settle down. And then you may switch over to shaman nasya.
Okay. There is a question. In skin
Another
patients,
way is give give sodhan nasya first. If the condition reverts back slowly, then you can alternately you give sodhan nasya, shaman nasya, and in between you can give brahman nasya. That all depends on the condition and stage of the patient condition.
okay. In So the last question. In skin patients, when long-term treatment is given, sometimes patients are asking how long we have to follow this restricted diet. What do we answer them?
We know the problem, samprapti about that skin problem. If it is samavastha, diet and treatment would be different. In Niramavastha, diet and treatment would differ. Of course, you have to take care of whether patient requires raktam oxygen or patient requires um, uh, virechan or basti. Depends on that, and along with local treatment. Depending on the condition, we have to design the line of treatment, and it may take longer time. When we consider this Sam Niram theory, Anuloman Pratiloman of Vat theory, uh, Dhatvagni, Jatragni, Dhatvagni, and Bhutagni, if we consider that, then the patient's problem shortens down comfortably well. It is not one line treatment, yes.
Agreed, sir, but sometimes in patients of skin disease, that short time is also a pretty long time. It feels like eons for them.
सारंग सरांनी मुलगी पास झाली म्हणून आणले चंदू हलवाई
काय म्हणालास तू?
હું સર એમનું માઇક અનમ્યુટ થઈ ગયું હશે એટલે અવાજ આવે છે.
See, in certain conditions, it would take longer time in terms of months and years together. Today, I had one patient who had a skin problem all throughout the body since the age of 3 years. And he went through so many pillar to post, so many doctors, so many homeopathies, Ayurveda, other line of treatment. Today he is almost 15 years. he came to me when he was about 9 years old. And when I saw him, I was really afraid of whether to treat this condition or not. There was no any other option because patient had already been treated by so many other consultants, even on allopathic side, homeopathy side, Ayurvedic side. I told the patient it may take longer time, and patient agreed. I said there was no any other option. Today patient came. He was absolutely fine, spotless skin, so confident, and started going out, attending the school, started playing outdoor games with vigor and zest. And that was the situation, but it took long time. In certain cases, it may take longer time. There is no choice.
Okay. Now, sir, I think we will wind up the session. I will ask Avdut to conclude the session. And sir, we will keep the next lecture next week or 10 days, 15 days. Should we declare right now or we declare it later?
We will decide later on.
Okay. Fine. Sir, anything that you would like to say? Otherwise, Avdut will just conclude.
I think few people have not been introduced last session. If the time permits, let them introduce themselves. Otherwise, we are done.
Okay. Sir, I have no idea if anyone from this list has not introduced themselves. I think everybody has introduced.
Nitin has not been introduced.
Nitin Goradia, sir.
Also. Nitin Goradia.
Nothing, sir, Atyana meeting mein.
Okay.
Nitin Goradia sir had introduced himself, and Kochar sir is not here right now.
1 minute, shall I talk for 1 minute?
Yes, sir, please.
To keep our mind calm and cool, we need to meditate ourselves before we ask the patient to do meditation of their choice. And this will help us tremendously. This is a message, take away message.
Thank you, sir. This is Hina.
Yes.
You're most welcome, Hina.
Sir, I needed to listen to this from you. So thank you so much for your takeaway message. I was not able to do it for many days.
Yes.
So thank you so much. I had to hear it from you.
Most welcome.
Yeah, true, Dr. Hina. So, like I always say that to meet sir or to listen to him is it's like recharging your battery. So it is definitely a good takeaway message from sir. And in today's session, we had...
loud.
Yes, sir. Am I audible, sir?
Now it is, yes.
So in today's session, we had discussed mainly with the topic of doctor-patient relationship, and definitely the questions which are coming to the mind are more regarding Nasya and Ashwatan, etc. But that would be covered in the coming sessions definitely. And again, we will revisit those questions which have been asked today in the coming sessions after the session on Nasya and Ashwatan particularly. In addition to this, if there is any other question, if that comes to mind in this coming week or the next week also regarding the doctor-patient relationship or the first visit of the patient, how we should manage ourselves, then you can post those questions in the group, or you can ask pose that question in the next session as well. So since it's time now that we can conclude the session for today, and everyone will be definitely, I'm sure that they are willing and they are eagerly waiting for the next session. So definitely we will post in advance, at least 4-5 days in advance, so that you can all manage your timings and everyone can attend the session in person. Okay. So shall we conclude, sir?